Hello, I'm Dr. Clint Sexton with Naperville Integrated Wellness, and I'm a functional medicine practitioner. Today I want to talk about the things that your doctor doesn't know about Hashimoto's disease. So one of the first things about this condition is that so much emphasis is just being placed on the thyroid and your thyroid hormone levels. What they're not addressing is the fact that the issue is that it's an autoimmune disease. And many doctors take the approach that it should just be a wait and see. Let's see what happens. It even has it right there on the website, the Mayo Clinic. It's a wait and see approach. But the only problem with this is that once you develop one autoimmune disease, such as Hashimoto's, you're more likely to develop other autoimmune diseases, such as type 1 diabetes, or rheumatoid arthritis, or vitiligo, scleroderma, celiac disease. There's a whole list of other autoimmune conditions that you are more likely to develop. So this wait and see approach really is not a good approach if you want to consider your overall health and what's going to happen down the road. The second thing is that the emphasis is only being placed on what's going on with your thyroid hormone levels and not what the disease that the immune system is causing, not what Hashimoto's is doing to the other systems in the body. And so this can affect your energy, this can affect your metabolism, this can result in hair loss or affect your skin or constipation or your mood or your sleep. All of these other factors can be present even when your thyroid hormone levels are considered normal or ideal. So it's two separate things. One is dealing with the level of thyroid hormone. Everything else, and the majority of this, is really looking at all these conditions that are being caused by the immune system, okay, as a result of the Hashimoto's. Third would be how we're looking at these test results. So many times I'll see blood tests coming in from other doctors, and they'll test a TSH. So TSH, that's just a hormone coming from your pituitary gland. That's not even a hormone produced by the thyroid gland. And there's many things that can influence this. Stress can change the values of that. Inflammation can change the values of that. Cortisol can change the values of that. The way that your pituitary gland is using thyroid hormone and not the rest of your body can change that. So many times what's happening is people are being prescribed medications based on the TSH. I call it chasing the TSH, but there's so many things that can cause it to go up and down. So that's just one aspect of the testing. The rest of it is looking at the actual hormone levels. So we do about 10 different tests related to thyroid in our office because there are other factors that can now change the values of those. One of the big things would be imbalances of other hormones. Imbalances of estrogen, progesterone, testosterone, even inflammation can affect these other actual hormone level values. So you have to understand what's going to influence your test results. So yes, you look at test results, you look at other factors that can influence those test results, and then you have to see how you feel and how you're responding. So once you get the hormones dialed in and everything and other factors that will influence that, you really have to look at the condition itself. Hashimoto's, this is an autoimmune disease. It makes you more susceptible to other autoimmune problems. So this wait and see approach is not a good approach. You're just waiting and hoping that you don't get more autoimmune diseases and hoping that your symptoms that are associated with Hashimoto's improve somehow on their own. So hopefully this just gives you a little different approach. These are things that aren't normally discussed with patients. Many times you're just told you have Hashimoto's, it's autoimmune. If you need thyroid hormone, we'll give it to you. If you don't need it yet, we'll give it to you later when enough of your thyroid has been destroyed. Again, not a good functional medicine approach. I hope you found this helpful. If you'd like some more details on this, check out the blog. Thank you.